Having a tool to help predict bladder exstrophy, bladder continence for future procedures is really useful for us counseling families and patients, as well as for other urologists. It's really important to kind of understand the primary closure, success versus failure, any need for reclosure. And this will help us determine if the patient's bladder capacity will grow in such a way that will allow the patient to be continent via voided continence, if they'll need to catheterize via urethra or via a Mitrofanoff, as well as the need for a bladder augmentation, which is where we make the bladder bigger, so increase the bladder capacity so the bladder can store a good amount of urine, and these patients will need to catheterize. Additionally, some patients may need to go on to have a neobladder, which is a new bladder formation using intestine so that the patient can store urine and have continence. And we see that in more severe forms of bladder exstrophy, cloacal exstrophy, as well as in failed closures. So this tool is really novel and very useful, especially for counseling patients from the very beginning when we meet a family that is expecting a baby with bladder exstrophy all the way to adulthood where we're doing continence procedures.